Okay, so you want to know the top 5 things we learned within the respiratory block at med school. Let's start. Okay, so the first thing we learned was everything regarding clinical skills. So we learned 2 vital skills within the respiratory block. The first one is the respiratory exam, and the second one is how to read an x-ray. So within the respiratory exam, you learn a lot of things. So you first learn how to do a respiratory inspection. So you look at the chest, look for any like scars or any surgical wounds or traumatic wounds. You look for things like a barrel chest, which can indicate COPD or asthma. You also look for, like in kids, you look for Harrison-Salkers, which is indicative of CVS disorders or even asthma, like hyperinflation. You also look for things like pectus excavatum, pectus carinatum. So you just inspect the chest wall and see if the chest wall is symmetrical. Then you would move on to percussion of the chest, which is basically where you percuss the chest and hear and listen to the sound. When you percuss the chest should be resonant throughout. If you hear like a stony sound or stony dull sound, that might be indicative of consolidation, which means like infection within the lungs, or it can even be something like pleural effusion, which is basically like water inside the lungs. Okay, so the third step is you'll move on to auscultation. This is where you listen to the chest to hear for any abnormal sounds. So you would want to hear vesicular breath sounds, which is normal. If you hear things like wheezing, this can be indicative of COPD, which is COPD is chronic obstructive pulmonary disorder. Mostly like smokers get COPD. So wheezing can indicate COPD, or it can indicate asthma. You can also hear things like crackles, which crackles is more indicative of infection, such as pneumonia. You can also hear like if breath sounds is present in both lungs, if there's a collapsed lung, which you call pneumothorax. So within the respiratory exam, there's a lot of like critical things we learned and something that we will use every day. So it was a very cool skill to learn. Okay, so the second cool thing we learned within the clinical skills was everything regarding x-rays. So we learned how to read an x-ray, how to start to read an x-ray, like how to have a good approach to reading x-ray, like starting with the name and age, hospital number, all those things. We learned how to identify a few things on x-rays. So the first one is like consolidation, which means like an infection, like a pneumonia. We learned how to see things like pleural effusion, which is like water within one lung, like a pneumothorax, which is a collapsed lung, things like hyperinflation, which is indicative of asthma or COPD. So reading a chest x-ray is very, very important. Like most people get a chest x-ray when they are in hospital, so it's a good skill to learn. All right, then the second cool thing we learned within the respiratory block was everything regarding asthma. So asthma is a chronic inflammatory disease of the airways. So asthma occurs in people with the right genetics and the right environmental factors. So it's a genetic and environmental component to developing asthma. Asthma is something that a lot of people have, and it is something that we definitely see. So we learn everything from how to identify someone who has an asthma attack, how to manage it, and all those type of things. So it was a very, very cool section and very interesting. All right, then the third cool thing we learned within the respiratory block is everything regarding TB. And as you guys probably know, in South Africa, there's a massive TB problem. Actually everywhere in Africa, but especially South Africa, TB is a massive issue. And it's still the #1 killer in South Africa. So we learned everything regarding TB, how to diagnose it, what sputum samples to take, how you should take it, all these types of things, like the management, what drugs you would give for someone with TB, how to instruct them to take these drugs, like how you should treat someone that is diagnosed with TB, but also now newly diagnosed with HIV, all these types of things. So this was very, very interesting and something you definitely use, as a lot of people have TB with HIV in South Africa. So this was a very, very interesting section. Okay, then the fun fact I have for you guys within TB is many years ago, when TB was a massive problem in Europe, they saw that people who spend a lot of time in the sun actually had a better outcome from the TB infection than people who didn't spend a lot of time in the sun. So what they would do is they would put people outside like for 4 or 5 hours a day in the sun. And this had a massive impact on how the immune system fought off TB. And many years later, we actually discovered that vitamin D is like the magic vitamin for your immune system. And it's actually especially important for people with TB. So this sounds good for you if you have TB. Okay, so the fourth cool thing we learned in the respiratory block was everything regarding respiratory tract infections. So it was your upper as well as your lower respiratory tract infections. So we learned everything regarding this, like how to diagnose the upper or lower respiratory tract infection, management, how to scent off sputum, all these types of things. This is also very interesting and something that you will use a lot. Okay, then the fifth cool thing we learned within the respiratory block in med school was everything regarding lung cancers. So we learned all the types of lung cancers, your pancreas tumors, mesotheliomas, the role of smoking, a role of asbestos within lung cancer, your pancreas tumors, how to identify a lung cancer, such as your Pemberton sign, hoarseness of voice, weight loss, all these types of things. And another interesting fact I have for you guys regarding this is many years ago, when they designed cigarettes, they decided to design a cigarette for women, and this was like a light cigarette. So it has less of everything, so less nicotine, less tar, less of all the substances they use within a cigarette, especially designed for women. An interesting thing what happened was when they brought out this cigarette is that the incidence of pancreas tumors, so lung cancers within women, actually increased. And the reason they found why this happened was when people smoke these lighter cigarettes, they actually would pull the cigarette smoke deeper within their lungs, and the smoke would cause more damage, leading to more incidence of lung cancer. So this is pretty interesting to know. Okay, so this was the top 5 cool things we learned in the respiratory block in med school.